Greetings to all. My name is Mayukmala Dana.
I am Shubhasri Basu, and the topic of our presentation is computer vision and its applications.
The outline of our presentation is shown in this slide. Computer vision is fast advancing technology that plays a crucial part in artificial intelligence. Today, computer vision is regarded as one of the most successful applications of deep learning, which enables computers to recognize images and videos using deep learning algorithms. Some of the real-life applications may include how the barcode reader at your local mall works, or smartphones of today can automatically click a selfie when you look your best. Computer vision is basically an interdisciplinary field that deals with how computers can be made to gain a high-level understanding from digital images or videos. With computer vision, a computer can extract, analyze, and understand useful information from an individual image or a sequence of images by applying deep learning algorithms.
From this slide onwards, we will show some applications of computer vision. Face recognition is one such algorithm that helps us to capture all unique factors of a face from multiple angles. Today, more than ever, security is a primary concern. Face recognition can work as a means of access control to ensure that only authorized individuals get into facilities like laboratories, bank vaults, and other sensitive locations. The technology is being included in our cell phones to unlock phones. If a phone is stolen, sensitive data remains inaccessible by the perpetrator. Apart from security, face recognition systems can make traveling more convenient. Airlines have started using them to help people check bags, check into flights, and board planes faster. Thus, it's making areas safe as well as accessible.
Gesture recognition. It is the process by which gestures made by the user are made known to the system. It can also be explained as the mathematical interpretation of a human motion by a computing device. As per the application point of view, the video controllers like Xbox by Microsoft having Kinect controller, or people who are visually impaired or have some other complexity in their motor functions can take help of gesture-based input devices. Other applications are switching channels without a TV remote, automated homes, and driving to safety. Emotion recognition is a method used in software that permits a program to examine the sentiments on a human face by utilizing sophisticated image dispensation. It helps children with autism, people who are blind to read facial expressions, helps robots interact more intelligently with people dealing with depression or any other psychological ailment. Also, monitors signs of attention while driving in an effort to enhance driver safety. Augmented reality, also known as AR, is an interactive experience of a real-world environment where the objects that reside in the real world are enhanced by computer-generated perceptual information, sometimes across multiple sensory modalities. It is, in fact, readily available and being used in a myriad of ways, including as Snapchat lenses, in apps that help you find your car in a crowded parking lot, and in variety of shopping apps that let you try on clothes without even leaving home. The use of it in enhanced navigation systems and by military fighter pilots to see an AR projection of their altitude, speed, and other data on their helmet visor are just some other uses.
Machine vision is used in various industrial and non-industrial applications in which a combination of hardware and software provide operational guidance to devices in the execution of their functions. Machine vision systems rely on digital sensors protected inside industrial cameras with specialized optics to accrue images, so that the computer hardware and softwares can process, analyze, and make decisions. The applications of machine vision are given in details in the next slide. Robot-guided surgery is an application of machine vision which allows doctors to perform many types of complex procedures with more precision, flexibility, and control than is possible with conventional techniques. The advantages of robotic surgery is that it reduces surgical site infection, causes less pain, less blood loss, quick recovery, and less noticeable scars. Also, vision-guided robots are widely used in picking and packing operations. In today's fast-paced production environment, picking and packing operations demand a lot of human operators, including uninterrupted speed, reliability, inspection, sorting, and accuracy. Thus, robots are being built which can detect the positions of target and send the position information to perform the operations with maximum repeatability. In order to interpret medical images used in techniques like X-ray and MRI, computer-aided diagnosis is widely being used by medical professionals. It can improve the accuracy in image diagnosis as it can detect diseases even if they are too small or in their early stages. Also, human observers are prone to commit errors when monitoring a patient's status. However, computers can be designed to record all episodes in a consistent manner and such errors can be avoided.
Medical imaging is the technique and process of imaging the interior of a body for clinical analysis and medical intervention, which is also an important area where computer vision is used. As a discipline and in its widest sense, it is part of biological imaging and incorporates radiology, which uses the imaging technologies of X-ray radiography, magnetic resonance imaging, ultrasound, endoscopy, elastography, tactile imaging, thermography, medical photography, nuclear medicine functional imaging techniques as positron emission tomography, also known as PET, and single photon emission computed tomography, also known as SPECT.
In this slide, we discuss the use of computer vision in medical imaging. Since modern healthcare operations generate large amount of data, these data provide valuable information regarding the condition of the patient, development of disease, and progress of treatment. Therefore, deep learning methods are able to provide high accuracy rate and enable input image analysis with an appropriate level of sensibility to certain field-specific aspects. Not intended to replace doctors, but computer vision serves the purpose to enhance and complement the very human interaction of provider and patient. With the ability to reduce variation and duplicate testing, decision support system quickly decipher large amount of data with the electronic medical report. Thus, it is being consistently applied in routine or repetitive tasks.
Deep learning is the fastest growing field and is widespread uses in cancer detection and diagnosis. Recent research has demonstrated that deep learning can increase cancer detection accuracy significantly. Deep learning in cancer detection, such as skin cancer or breast cancer, is used to track and analyze the development of metastatic cancer. It examines the stage to identify anomalies and track its development. In case of breast cancer, a deep learning neural network is used to compare mammogram images and identify abnormal or anomalous tissues across numerous samples. In case of skin cancer detection, deep learning is applied at the examination stage to identify anomalies and track its development.
Convolution neural networks has the ability to process image with numerous filters, can be trained to identify common anatomical patterns, and requires relatively small number of clinical trials. For the above mentioned reasons, it is suitable for applications such as tracking tumor development and also in medical image analysis. In this slide, we will present the role of neural networks for tracking tumor development. There are multiple layers in the convolution section which help to sequentially identify the critical features of the tumor, which include tumor location, area, shape, and also its density. These data serve as an impactful factor for identifying the stages of a tumor, the transition points, and the anomalies. Now, coming to the field of medical image analysis, convolutional neural network methods are also increasingly applied in a wide range of areas to complement or replace traditional models. It has shown remarkable improvement in several image processing areas such as image reconstruction, image quality improvement, and image segmentation. Image recognition techniques can spot anomalies and identify specific indications of different diseases with the help of neural networks.
Retinal blood vessel segmentation plays an important role for retinal image analysis. This is a difficult task as the blood vessels take just a couple of pixels contrasting with background pixels, which makes them hard to spot, not to mention analyze at the appropriate level. Overall, there are two ways deep learning improves retinal blood vessel segmentation operation. Image enhancement can improve the quality of an image. Another, substructure segmentation can correctly identify the blood vessels and determine its state. Cardiac arrest is a major burden to public health, which affects patient safety. Cardiac assessment is most complicated cases that require lots of data to spot the pattern and because of time constraint. Deep learning fits into the following operations. 1. Blood flow quantification, that is to measure its rates and determine its features. Second, perform anomaly detection in the accumulated quantitative data. Third, data visualization of the results.
Musculoskeletal disorders are injuries or pains which affect the human locomotive system such as joints, ligaments, muscles, etc. and are the leading cause of disability. Image classification and segmentation are two cases where neural networks are best suited at. With the recent developments in computer vision and increased availability of large radiological datasets have enabled deep learning models to achieve high performance and can also make the radiologist's job much easier. The machine vision image guided surgery gives the surgeons a 3D scan of patients during surgery. The medical practitioners can control and adjust the robot, hence obtaining surgical assistance and improving the accuracy. Surgeons also get a depth view that is not provided in microscopic scan or 2D scan. Thus, it ensures that patients experience least pain and is also likely to be discharged early.
Overall, it may be said that there is a lot of research being done in the computer vision field, but it's not just research. Real-world applications demonstrate how important computer vision is to endeavor in business, entertainment, transportation, healthcare, and everyday life. A key driver for the growth of these applications is the flood of visual information flowing from smartphones, security systems, traffic cameras, and other visually instrumented devices. Here comes the application of deep learning algorithm. Deep learning specialists utilize this information to make the procedure of computer vision applications increasingly accurate and quick. Thank you.
Thank you.